Hi, my name is Anna Marie Smith. Today I'm going to be doing the catheter practicum. As you can see, I have my vagina right here. So I'm going to be doing a female. First, I would confirm the medical order, and I review the patient's chart to make sure if there's any limitations, physical limitations the patient may have, any other conditions they may have that would affect this. I would review their allergies. I would then consider if the patient, how much the patient is able to assist me in this procedure, and if they're able to follow directions. After that, I would consider if there are any lines, tubes, or drains that I need to be aware of and get cautious of. I would then get my kit. I have my kit right here, and I have my gloves and my washcloth and basin on the floor. I would gather all my supplies, and I would consider at this time, do I need another person? I do not need another person, so I can go ahead and proceed. If I did, I'd go get them at this point. Then I would close the door, close the curtain, provide for privacy, and I'd wash my hands and put on any PPE that I need. At this point, I would then provide for ample lighting. I have my lighting, it's artificial, and I can see everything and it's good. So I'm good at my lighting. And then I would place a trash bag. I'd place a trash bag so that I can discard all my supplies and once I use them, right by the bedside. I would go into the patient and I identify myself, identify them, explain why we're doing this, and ask if they have any allergies to latex or iodine, and ask how much assistance they were able to provide for me at this time, if they are able to. After that, I would then raise the bed to my working height. I'm going to be doing on the right side since I'm right-handed. So I'm doing this on the right side. So then I'd raise the left side bed railing up so they don't fall. Taking careful, not to ensure patient safety. Number one. And then once I've raised the bed to working height, I would then assist them into dorsal recumbent position. So I'd have their feet flexed 2 feet apart, and I would drape their upper body so that only their perineal area is exposed. Once I have that, I'm going to then put on clean gloves and wash. Have soap and water, and I'm going to then wash, rinse, and dry them. I'm going to take care. I've folded like so that I can just, using a clean swipe washcloth, using a clean portion of the washcloth with each swipe. And then get the right side, the left side, and the middle, making sure. And then I would wash them and dry them at this point. Okay, then I'd discard my gloves. Now that they are washed and ready, I'm going to again get my kit. For her, we're going to move her for a bit. Ready for me. I have a sterile sheet that I'm going to ask the patient to lift up and place under it. Prior to washing her, I would actually have placed a bath towel. So she would have a bath towel at this point, and now she would have this. I would assist her, help her, and put it under her. At that point, then I would don my sterile gloves. So I'd put on sterile gloves. And then take apart my tray and remove it. Once I have this, I have her perineum. And I'm going to drape this going to drape this and cover her perineum. Then I'm going to get everything in my supplies ready. I have my lubricant. I'm going to dump my lubricant in its receptacle, or not receptacle, in its proper place. And then take my catheter 2 to 3 inches, hold it above, and dip that. Make sure that it has no holes and it's not kinked. It's kink free. I'm going to dip that end into the lubricant. And then I'm going to place the end that the urine is going to be coming out of, but it's going to attach to the Foley catheter bag. The catheter bag, I'm going to put that in the receptacle so it can drain and catch the urine in that process. I would then inflate. I would also inflate. I take my saline-filled syringe and inflate the bag just to make sure that it does inflate and there's no problems, it's not leaking. After that, I would deflate it and attach it, leave it attached, and put it off to the side. I would open my swabs. I'd open my betadine swabs. I have my 3 swabs that I have here. And I'm all set to begin this procedure. To begin this, I take my non-dominant hand and I would spread the labia. Since the labia is, I would make sure I am able to maintain this position until I'm done with the procedure, till I've gotten urine return and it's draining correctly. So now that I have that, I'm going to make sure before this, I would tell the patient that I'm going to touch them. So I make sure that before I actually touch them, I would make sure to warn them, I'm about to touch you, you're gonna feel my touch. So I'm going to take this betadine, because after I've warned them, after I have opened the kit and draped them, I'm going to do this, and swipe. Once I have swiped, it goes into the trash receptacle. Swipe in the trash receptacle. Down in the middle, and then the trash receptacle. I have looked for the wink, and now I'm going to hold the catheter that's lube 2 to 3 inches, so I'm not touching the lubricated spot, and then I'm going to advance it. I'm going to advance it first, and then I'm going to hold it. I'm going to advance it until I get urine return, and once I get urine return and it's drained, I'm going to advance it 2 to 3 inches. 2 to 3 inches, and then I'm going to move my non-dominant hand and hold it while I inflate it. Once it's inflated, I'm going to give it a little tug to make sure that it's that the balloon is holding. Once I have assessed that it's holding, I'm going to attach my catheter to my Foley bag. So my Foley bag, and I'm going to put this below the level of the bladder and make sure it's not in the way of any railings or anything that can get caught or kinked. So this is going to be below the bladder, and I'm going to then tape this around my patient's leg, secure it, allowing room for leg movement as needed. And I'm going to then discard all my equipment. I'm going to put all my equipment. In the proper place. Remove my gloves. Put my saline syringes and my lubricant syringe in the sharps container. I would lower the patient, cover them up, and then I'd ask if they needed anything. After that, I would perform hand hygiene and I would go document. Thank you.